leadership has had to say on this issue. Now, we have seen industrial actions coming from the pre-medical interns. We have seen industrial actions coming from the senior house officers, but we also have the medical officers special grade who are adding to that list of industrial actions. So we want to find out why medical officers special grade also adding to the industrial action. What are their claims? Why is it that they have decided to down their tools, and what is the way forward? And we are talking about this especially in light of what the Minister of Public Service had to say that, well, those who are serving in government should get back to work because people need treatment, especially those who are medical officers. But secondly, interestingly, what President Museveni had to say, who said that right now, because of the economy, things are a bit complicated. There's no money, and so those who are in public service, who are working for government, should either work for no pay or low pay. They should be patriotic. So the medical officer special grade, not patriotic? We shall find out whether that is the answer to the question. And joining me to discuss about this is Dr. Joel Kimera, who is a medical officer special grade. You are welcome to Issues at Hand this morning.
Yeah, thank you, Bruno. Yeah, good morning, everyone, our viewers, including our listeners. I'm Dr. Joel Kimera. I'm a pediatrician. I'm from Mityana General Hospital, but I'm also a member of the Uganda Medical Association. I'm a mobilizing secretary of the Medical Officer Special Grades. So currently, we are involved in an industrial action, which we announced, that's about a week ago, that's last Tuesday. And I want to begin by defining who a Medical Officer Special Grade is. So this is a term under the public service definition and rank in the medical fraternity, or what you can say, Ministry of Health ranking. And the medical officer special grade by qualification. This is a doctor who has not only the first 2 degrees, which we categorize as MBCHB, okay, but also has a master's degree, which we call a Master's of Medicine. So the entry into public service, either through the Ministry of Health or through the other sister ministries like local government, is Masters of Medicine. So medical officer special grades, currently in public service, we are 266, round about there, about 270. And we are crucial cadre, as we have always been explaining. These clinicians include pediatricians, of which I fall under, and child health. We have obstetricians, those who operate women, who are going to give birth. We have surgeons. We have ophthalmologists, we have anesthesiologists, those who make you go to sleep when you are going to have surgery. We have several cadres under here whom I cannot completely exhaust. So we have very many, and we fall just slightly. We are just below a consultant, who a consultant is just below a senior consultant. So, for instance, when I use the military, comparison, we are all generals, with the senior consultants at the top most are the generals. Below them are consultants under the medical officer special grade, whom we want to change to associate consultants. So we are highly qualified, as you see. Many of us have not only 3 degrees, many of our colleagues have 4, 5 degrees, including some have PhDs, and some have fellowships. So the entry into public service of medical officer special grade and consultant, senior consultant, it's the same in terms of qualification. Only we are separated by the years and the experience. So I hope I've answered who medical officer special grade are. Let me go straight to industrial action. So industrial action, one, it is a constitutional right that workers go to stage an industrial action. When we are saying that there should be reasons as why industrial action is taken. First, negotiations have been carried on, must have been held, and probably we hit a snag, and that's what we have been having. So industrial action is not new, but I say that this is a constitutional right enshrined not only in the Constitution of the Republic of Uganda, but also in labor laws when you go to International Labour Organization, and so many other conventions of rights of which Uganda as a country is signatory to. So we are not doing something new or something illegal. We are bound by all these conventions, and we are still operating within the legal framework. So the history of industrial action in the medical fraternity in Uganda is as old as 1996, so many years back. But let's go into the recent industrial action, which happened in 2017, when Uganda Medical Association was under leadership of Dr. Oboku Ekwaro. And it's this industrial action which we are still actually carrying forward. That it was actually resurrected in 2021, because we just suspended this industrial action when we met the president and all the other stakeholders. So in 2021, still when we are coming out, we just suspended, which means we are acting out of the lifting of the suspension of the industrial action of 2021. We are not operating illegal. So we did not, responding to the Ministry of Public Service as we have done, we are not carrying out an illegality. We are operating within the law because we just lifted a suspension. It did not warrant us, to issue a notice of carrying out the industrial action. It did not really warrant it.
So take us through the history. In 2017, why was that industrial action there? Yeah. Now on to where we find ourselves here in 2023. Yeah,
so going back to 2017, this part of the reasons were, one, a lack of supplies, low budget of the Ministry of Health, lack of supplies in the supplies. Things we use like gloves, soap, machinery, things which we use, injections, drugs, which are very, very important, for the welfare of our patients. Whether we're going to operate patients or we are treating diseases like malaria or hypertension, so we have presented to government that we are working in very, terrible environment in 2017. That we have very low budget for this National Drug Authority and Ministry of Health. The budget has been getting lower. So the reasons were basically emanating from supplies and sundries which we use to carry out our activities in the different facilities where we are along the chain. So, and the other reason was the low pay still of all health cadres. And we thank government that when we really declared industrial action in 2017, government gave us listening ears. They did not chase us away. They didn't arrest us. They listened to us. They called us and we sat with stakeholders in many different ministries. And we sat again with the parliament. We also held very long meetings with His Excellency the President, and we applaud him for this. And out of that, 2018, the President, from the negotiation which we had, he directed the public service actually, or reviews the salary. But also there was also an agreement that supplies in the hospitals and the health facilities actually improved or increased. And we applaud government. There has been a steady increment in supplies. But there are some obstacles because health is a very, very complex item to handle, not only for us as a low-income country, but even for countries which are, especially where we are providing, free health care and people do not actually pay in government facilities, ideally. So government listened to us. And there has been, it responded to the supply. They are trying, though, still with, delays here and there and shortfalls here and there. But with the salaries, there was also a revision in salary, especially the scientists, of which category I also fall. So we applaud government here, and we say that they increase the salaries of scientists, and even the doctors under which I fall. But we are saying that one category was forgotten, and that's the category for which I speak, for the associate consultants and medical officers special grade. We were not increased in salaries, and this we have stated.
That's according to the collective bargaining agreement.
The collective bargaining agreement left out this cadre, and we have been laboring in all these negotiations, including the ones we have had just last week and the years before, in the last 5 years. You forgot, you left out the category of medical officer special grade. And
the question I have from that is, were medical officers special grade part of the negotiations in 2017 before the collective bargaining agreement was?
Definitely.
So how was it missed from the salary increase?
Definitely. We are part of Uganda Medical Association, and we have members sitting on these executives. So our leaders have they reached out to Ministry of Public Service and Ministry of Health, informing them that you have increased these people's salaries, but you have forgotten to cater for a very important cadre, medical officer special grade, of which we have similar qualifications just as consultants and senior consultants. It's just the years of service which differentiate us. And as I say, like in the military, we are all generals if it's the military. So we are earning half of what a consultant gets right now. 6 million, and the consultant is at 12 million, and the senior consultant is just at 13. And initially, before these salaries were increased, we had a difference of 1 to 2 million amongst us. And this was in keeping with our academic qualification, and more so even our terms of work. And we are saying still medical officer special grade, many of us are stalling at this level. Many of us are not being deployed actually. And many of us not only being deployed even when we get the qualification, academic qualification, the Master of Medicine, we stay, most of our colleagues are actually at medical officer level, including here at Mulago and the National and Kawempe Hospital and many of these hospitals and health center force. We have people who have master's degrees who are registered as specialists in the Uganda Medical and Operations Council, but continue to practice, to continue to work as medical officers. So our problems are big. And that says still, we have colleagues who are medical officers, special grades, who have been in this title for 20 years, you can imagine. I'm with now my teachers in this struggle, people who taught me in medical school. I'm still with higher than them. And some of our colleagues have even gone on to become consultants, yet our teachers are in Mulago are still at the same level of medical officer special grade in different categories. So this one is a weakness.
How is that possible?
It's very possible. If you go and do research, you'll get shocked that we are grandchildren, but we are agitating for our grandparents in the same rank and in the same, institutions. So this is a disaster in the Ministry of Health. The promotions are not easy to come by. And many people, and this is what has resulted in most of our colleagues, leaving the country. If not, they don't leave the country, we are suffering with brain drain inside, where most of us have gone into, farming. If not, we are in Chikubo or Wino. Others are selling cars. Or if not, and others are just, have lost interest and they have resorted to, working a few days a week, if not 1 or 2 days, because they were forgotten. And they say many of them were not promoted in service. And we have presented these issues to government. Please promote us. Please promote us. And even when we declare industrial action, for instance, I can use a very good case example, is Kawempe Hospital. That we realize that they only have one consultant who is a senior consultant. So imagine if the medical officer special grades, they are gone straight completely. A hospital which delivers over 60 mothers in a day it has only one consultant or senior consultant. So it's a tragedy which has befallen most of our hospitals, that we have people who are qualified to be consultants, but we don't know whether the government, in a way of reducing the wage bill, keeps us stunted at the level of medical officer special grade. And which we say that this one, not is it demeaning and derogating, but it's a term which is colonial. We said it's colonial because the whites did not really think that blacks could actually be doctors during when the British were here. But that said, even when they say they could be doctors, okay, they couldn't be consultants then, okay, call them medical officer special grade. So we have a colonial battle which we are trying to address, that we please turn this title into associate consultant. Because when we go to public service, they think that we are the same as medical officers. A medical officer has only spent 6 years out of medical school. And we are earning 200,000-300,000 just above them on net pay. So by the time I trained to become a medical officer special grade, I've spent at least 10 years in school, aside of the years that I'm spending in service. And we are saying medicine is a lifetime profession. So you can see why we are losing most of these colleagues of ours. Young, talented, energetic, people who can do so much research and who are, wanted in countries around us and so many other countries beyond.
On salaries.
Yes.
So the salary has not been increased the way
it was increased by about 300 or 400,000. When they doubled the salary,
there was an increase.
They increased a salary, but it's negligible in mathematical terms or in real terms. A consultant who was at about 6 million is earning 12 million, and we have the same qualification. And actually be surprised that many of our colleagues actually more qualified than some of the consultants currently, because the young generation of doctors is actually reading more than the old generation. So we are in a quagmire, asking ourselves, do we consider years of experience? If you consider years, what about the qualifications? But what about even the minimum of basic qualification of entry into public service, which we are holding, but which Minister of Public Service chose to ignore? But
and now on that,
yes,
we've seen, for instance, the pre-medical interns and other sectors, other groups talking about why they are putting forth an industrial action is because they've not been given allowances or payment for months. Yeah. But when it comes to medical officers, special grade, have their salaries been paid?
The salaries are being paid on time. We are not refuting that, but we are saying they're not commensurate with our level of training and experience. And more so that this was a mistake, which was public service has acknowledged, including Ministry of Health, that this is a misnomer. We are earning a salary which we are not supposed to earn.
Okay, there are
Yeah.
Ugandans out there who might be listening who are saying, but really, I mean, that's something that's affecting many sectors. Many people want more salaries, but unfortunately, the salaries are not being increased to their liking. So, to help us understand the plight furthermore, can you take us through how, one, things like lack of supplies and lack of deployment affects the day-to-day work experience of a medical officer special grade, but also to help us understand you if further how this issue of lack of salary increase also affects a medical officer special grade.
Okay, let me go back to the the issue of the number of doctors we have currently. Currently in the Uganda Medical and Dental Practitioners Council register, we have about 6,000 doctors registered. Half of these are the ones who are in current clinical practice. Yeah, around 3,000 doctors are the ones in active practice. And currently the population of Uganda stands at we are about 50 million. It increases at a rate of 1.2 million per year. That's 3% per annum. And the fertility rate, Uganda is one of the countries which has the highest fertility rate. You know, countries like Niger, I think, and Afghanistan are the ones which are slightly ahead of us, but we are one of the countries which carry, you know, a highest fertility rate in the world, which means our population and our needs increase. And that's why we are saying that the numbers of doctors which are increasing should not be a burden to our government, including our category who are specialists. So the doctor-patient ratio in our country stands at one doctor to 20,000. And this is way outside the recommended World Health Organization or WHO recommendation that a doctor should be responsible for 1,000 people. So that's a doctor. We're not saying even at the level of a consultant or a medical officer special grade. A doctor should be seeing 1,000. But now a doctor in Uganda is responsible for 20,000 to 25,000. When we look at the number of doctors we are having as a country, it implies that we are having a deficit of about 45,000 doctors to bridge up this gap, so that we have 50,000 doctors to cater for the 50 million, and we arrive at the 1 to 1,000. So as a country, we fall way below the recommended, and this one will actually delay our achievement of the Sustainable Development Goals, which we initially called the Millennium Development Goals, which are meant, to improve on the expectancy, the survival of people, the death, reduce on the maternal mortality, reduce on the under fives, get us out of poverty. And all this we are talking about is enshrined in the goals and the mission statements of all these, what we call the Vision 2040, the Parish Development Model, which, the president, our dear president, His Excellency is trying to promote, promoting in Uganda currently. And these are also in line, with universal health coverage and other international conventions. So the issue of the number of doctors responsible for the population, especially here in low-income countries like Uganda, is a very serious issue. It is directly impacts not only the well-being of people, but also even the economic development. That when a country registers reducing number of children who are dying, increasing, number of people who can access, drinking water and toilet facilities and all that, all this is in keeping with all these visions we're explaining. And they are all tied, to the welfare of the health workers, tied to the number of health workers, including the well-being of the health workers. So, going back, when we upload government, that we have been recording improvement in the survival, in the lifespan, how long a person lives. And we say that in Uganda, a person used to survive up to about 50 years in 1950. 50 years, and person could die. But currently we are at 60 to 63. And this all is coupled, by the steady improvement in immunization coverage, the access, to improved amenities like water and all that. And also, training more health workers, and people, improving on communication. And so all this, you see, these are the pillars we're talking about. But human resource, of which doctors and nurses and others fall, and where they form a key component of the economy, and we are responsible for sustaining this economic development and, gradual improvement, which we're seeing, or steady progress we are talking about. So you cannot talk about growing an economy when you're not growing a healthy workforce. And that's why we're emphasizing that these issues are important. So the lack of supplies, as you see, this is a chronic problem for our society. But going back, that the issue of health and health and medical care is a very complex issue. And this one, as you say, if you compare with countries like United States, they've been battling with the Obamacare. You know, when Trump became president, he also wanted to remove the Obamacare somehow. And accessing health, the United Kingdom has the national health insurance, you know, where a majority of the people go, and they go to see general practitioner. Many of them cannot actually access saying consultant or senior consultant because of, you know, the requirement to paying out of the pocket is way big. So the issue of health is not only a problem for in countries like Uganda, but it's still a big problem for developed countries. And it's countries, I think, like Scandinavian countries and Switzerland and maybe Australia, which have moved strides, you know, in improving access to health care and, you know, making government become responsible. So
in your honest opinion, do you think the government and other related stakeholders prioritize the issue of health in this country?
When you look at the things put on paper, there is an attempt to prioritize. But in practice, there is no clear prioritizing. And let me go about prioritizing. Prioritizing is about allocating resources. And resources are both financial and personnel. And this is where we are. We're saying that the doctor-to-patient ratio is low. And the ministries are saying that the medical schools are training a lot of doctors and making it hard for government to pay the intern doctors. And we're saying, no, we're not even reaching the required or recommended 1 to 1,000. We are still at 1 at 120,000. So this is where they fall low in implementing, actually. They are not putting health as a priority. Let me go back to budgetary allocation. And I want to talk more about the Abuja Declaration. Those who can Google, you can look for the Abuja Declaration, which was signed by our very president currently. And that Abuja Declaration, where all heads of state sat in Africa, especially, these sub-Saharan African, and they say that countries of the world should should commit themselves to committing 15% of the national budget, like the one which we are planning to read, to health. But one country which I've been reading about following is Rwanda, which has been able to contribute more than 15% to its national to health. Uganda, much as we signed this agreement, or this convention, we have continued to reduce on the budgetary allocation to health, and this covers all these supplies we are talking about, the research which we should be doing, you know, the payment of health workers, the deployment, the salaries. And let me go back. About 2 years back, we contributed about 8%, okay, the financial to 8% of our national budget. We have continued to reduce the contribution to 7.3. And in the recent budget, we have continued to suffocate health budget to below 7. We are about 6.2 or 6.3%. So this will make us deter in the achievement of the sustainable goals. Reduction of poverty, reduction of the under 5 dying, reduction, you know, of maternal mortality. We may actually now have a deterioration where these initial gains actually turn into losses. We start losing out. So government here is not prioritizing health. And I can even state that we are surprised in Parliament about 2 days or 3 days back, where one of the ministers of finance, stated that he will not give a supplementary budget, it's alleged, to the issue of interns and the SHOs. Yet we are seeing supplementary budget being presented for other areas to the tune of 4 trillion. And as you read about the budget right now, it is now swollen by more than 4 trillion, about 52 trillion, including what they presented about 3 days back. And the issue of health workers still missed out. So you are seeing how we talk about prioritizing health, but in practical, we actually do not prioritize health as a country and as government. And we are saying the issue of health is a responsibility of the government in power, because the health, all this what we're talking about, economic improvement and empowerment, cannot be based on a sick, unproductive, and sickly, weak population.
Indeed. Now, something that's very interesting in terms of one of the qualms you have with the Ministry of Health and of Public Service and with government is the issue of the title. So, and I remember telling you that I watched your news recently where you were saying you would like the title to change from medical officers special grade to associate consultants. Okay. Why is this important? There might be some out there who might be saying this is just an issue of vanity.
Yes, and we really applaud the government. It has listened. We were with Honorable Prime Minister and Minister of Public Service. And one, we are saying, why is this title important? When we were with these officials, there was, as we have actually had a problem with the Minister of Public Service, in understanding who is a medical officer special grade. So did we find a problem, physical problem, when we were there with the officials, that we had to explain. They thought that the consultant, senior consultant, are the ones with the skills. But we said we are here actually with the same skills, because the entry point into public service is actually just Masters of Medicine, which basically we all have. So in terms of skills, you will even get shocked that many of us are more skilled than our supervisors. And it's not surprising that people now read more and actually research more than the people in the olden days. So in terms of skills and qualification, there is no problem. So the argument, which I'm sure the honorable ministers brought, that these people have a point. They have the same qualifications. And some of them actually, in terms of experience, we are the same. It is just promotion, which is delaying most of us to be promoted. Like me, I've spent about 6 years in service. I should actually be now moving to consultant level, giving space to somebody below me. But you find that it's someone whom I found who is 15 years still at the same level, which means there's stagnation. And this stagnation creates, frustration. Frustration creates, giving up. It creates people, brain drain inside and outside. So the issue of medical field, this term we are saying is a colonial term. Other countries like Kenya, you spend 2 years with your masters, you have registered 2 to 3 years, you become a consultant. Uganda, we are stalling. Why are we stalling our individuals? And yet we are talking about improving healthcare, retaining people who are highly skilled, and all these, are key, in empowering our country to come up from low-income country to middle-income country. So our policies speak, but our implementation is lacking. We're saying, let's have a change from this title. Just seeing the title before even we give them money.
The title is a representation of promotion.
The title is not even yet promotion. We are saying if the title is changed, but can we look into promotion? We are saying down the hierarchy. People are stalling. We have less than 200 senior consultants in this country in the medical field. You can imagine. We have less than 200 consultants still in the medical field. We have less than 300 medical officers, special grade, whom we are calling associate consultants in the medical field. And we are talking about a population which is growing at a rate of 3.3% per annum, adding about 2 million of every year to this population, which is stalling in having high-level caliber. People who should do research, who should operate, people who are needed in other countries. But how do we keep them here? Tomorrow they're on the plane and they're running away. And I'm telling you for sure, not even threats from this government can make doctors stay here. They are moving even as we speak, especially at this level of specialists. And you find them in many hospitals, including in the UK where you want to go, in the US, in South Africa, Botswana, and you go to Lesotho, and all these countries, Kenya here, Aga Khan. We are there. Why? Because our countries have refused to remunerate us, to recognize us the way we should be recognized on international level.
Indeed.
Good.
So the question now, one of the most important questions is, what does this industrial action mean? Does it mean that as a medical officer, special grade, you are not working at all? You put down the tools, and those who want to access your services will not be able to access them, and for how long?
So what does it mean? One, we called for this industrial action through our mother association, Uganda Medical Association, that we lay down tools. But we cannot force everyone to toe our line. I've told you that we have an example here, Kawempe Regional Referral. It's a national referral hospital. A hospital which is at the topmost, where all our obstetric complication mothers have failed to give birth. They have retained placenta. Their mothers who have very difficult pregnancies are concentrated. It has one senior consultant. And Minister of Health has been looking. It has only one consultant. Which means if the medical officer special grade choose to lay down tools, death, maternal mortality will be very high in Kawempe Hospital. And which means our colleagues have been begged, please stay and provide this care, and we upload them, they have stayed. Imagine they had pulled out. And this is not only in Kawempe. Go to Naguru Hospital. Go to Mulago Hospital. We have even our colleagues. When I was an intern doctor in 2008, there are doctors whom have graduated to become medical officer special grade. They are still medical officers, and they really supervise my internship. This is a disaster. These are doctors who are nearing retirement, but they have nothing saved in their pension skill, or even not only in the social protection. Nothing. If you spend all your useful years at a lower rank, for instance, you are a corporal or sergeant in the army, and yet you should be promoted to become a lieutenant or general. This is disaster for your generation. How will you be able to take your children to school? God forbid if you got a serious illness or a stroke, you cannot be able to pay. Doctors were here. We don't have we don't have insurance. And yet, people in parliament, people in ministries here have insurance. And these are the issues we are talking about. That the money which you say even increase for us, it is money which actually is meant actually to treat us. We can't be treated in the hospitals where we work, or even the hospitals where we work. If they're private, if you go there, we barely get access to these services. And one, we are an endangered species as well. As we work in an endangered population, we are also liable falling prey to the social calamities in the environment in which we operate. And we're saying, can we have a change? You cannot offer health when you're unhealthy.
Yes, but laying down these tools now means that a lot of Ugandans, like you said, are going to suffer. Now, we thank those who are bold and have decided to not toe the line and have said, I will work and I will serve. But what about the rest in facilities where there might be medical officers, special grade, who have decided to hold down their tools? What is the fate of these people who are coming to seek these services? And I ask that in light especially of the so-called, and I know you've had it being brought up many places, the so-called Hippocratic oath that you have to serve and save lives when it comes to those who need treatment.
Okay, let me address these issues. Government has knowingly laid down tools of health workers. I state this. One, we are saying we have interns and senior house officers. The interns go up to the level of the district hospital, all right, and some PNFP, private for not-for-profit hospitals, where, you know, the majority of the Ugandans can access health care in the districts and far away. Government has stubbornly refused to deploy interns. This is shocking. No country in the world does not pay intern doctors or intern nurses or intern midwives. It is going to be Uganda the first of its making that we can prioritize other areas, and we fail to prioritize doctors. So government is making doctors is laying down hands of doctors, especially on the intern level, and the senior house officers. And these are the ones who are working to become specialists where I am, in Mulago, in Mabara Hospital, and in some other hospitals. But these are the major hospitals which, you know, are anchoring the entire health sector of Uganda. Mulago National Referral Hospital, super specialized. So government is the one laying down first the hands of we health workers. And then we come in now. They are no interns and essentials. And we're saying these ones contribute 70% of the work where they work. So are we the ones laying down our hands, or is government laying down our hands? It's government that is laying down our hands. And that said, now we have been the only people, we are among the few cadres who had remained, you know, on the structure to support this already limping system. And at the same time, we are also having our own problems. And that said, we cannot work every day. And if you go there, you can work 12 hours non-stop, seeing without a lunch and breakfast, seeing patients. So you are seeing the problem that is government partly actually, which is first holding its hands back, and once, you know, tired, overworked doctors who they may refuse actually to improve on their salaries, that they're the ones who should be sacrificed. We are going back to the Hippocratic Oath, and let me give the history of the Hippocratic Oath. Hippocratic Oath comes from that our grandfather of medicine, who was called Hippocrates, who was a Greek, I think, Greek. And it was, you know, he lived in the BC before Christ times, before Jesus Christ came to this Mother Earth. Hippocrates was there. And Hippocratic Oath, you know, requires us to render our services, to commit ourselves, you know, that we give our all in all situations. But this Hippocratic Oath...
Not in all situations.
Yeah, okay, we are not saying not in all situations.
Yes, that's a very key word there.
Yeah, we are saying, okay, we prioritize patients first, then we come in. But it does not say that we work when we are sick, that we work when we are endangered. Because in such situations, and we have seen where doctors have been swallowed up in the process of giving services. We lost doctors during COVID. We have lost doctors during Ebola, and they have not even been compensated. So the Hippocratic Oath does not hold us hostage, does not hold us, you know, does not imprison us. We're not imprisoned in the oath. And actually, if you follow different countries like in the US, they have gone ahead with changing some elements of this Hippocratic oath. It should not render us to work in environments where we are ourselves can succumb. But many times, actually, we succumb. As you saw, we lost colleagues. I lost my friend, Dr. Ian, who was an ENT surgeon, Ian Bwete. He died of COVID. We had neurosurgeon, Dr. Mukasa, who died of COVID. And we are saying most of these, including other nurses and what, the government has failed to compensate these health workers and their families. Were they prisoners of the Hippocratic Oath? I don't think they were conscious prisoners of the Hippocratic Oath. So we should work putting the Hippocratic Oath in practice, but we should not be endangered and imprisoned in this oath.
Yes, so we also have to think about the plight of health workers. Now, we're going to continue with this interesting discussion after this quick breather, so you don't go anywhere, as we want to find out what now is the way forward, especially in light of there's a bit of hearsay back and forth between government and the medical fraternity on this issue. Keep it locked. You are still watching Issues at Hand here on Church of Uganda Family TV. You are still watching Issues at Hand here on Church of Uganda Family TV. For those of you who have just joined us, we are talking about an industrial action. This time, where we know we've heard about the industrial action of the pre-medical interns, the senior house officers, but this time we are talking about the medical officers special grade. And with me to discuss this issue, for those of you again who have just joined, is Dr. Joel Kimera. Now, there are, like I said, there's a lot of back and forth. Who said what, he said, she said. That there is talk from the Ministry of Public Service saying that as far as this industrial action is concerned, and that's why they were talking about its illegality, that one, there were no negotiations or avenues of discussion coming from the medical officer special grade, that you didn't go to Ministry of Public Service or the other stakeholders to negotiate like the senior house officers have, and there was no offer of notice to carry out an industrial action given to the stakeholders, and that from their end shows that that maybe the medical officers special grade are not really willing to find an alternative solution from industrial action.
Thank you, Bruno. We're back. Now, the issue of negotiations. It's not true that we have not had negotiations. We are saying that these negotiations date back 7 years ago, 2017. In Uganda, how people interested with these offices work is interesting. Documents which we have written and handed over to Ministry of Health, Ministry of Public Service and Ministry of Finance, fully stamped. You arrive at the key officials and they deny ever seeing these documents. And this is a scandal. It's you can't believe it. I'm sorry.
Is this since 2017?
Yes, these documents are there and we have copies. Even when you go to office discussions now and we present a document, from which we have written from Uganda Medical Association. Ministers say they have never seen these documents, but the documents are stamped. So who is telling lies here? Then hide and seek, where you want to meet the minister and you cannot meet her. This is our own minister. We are lucky we meet the public service, the PS, the permanent secretary. But after ages that we are, I hide and seek to meet officials interested with authority. And we thought that we believe these people sit in cabinet. And this cabinet is chosen by one person. And this cabinet is the one implementing the manifesto of the government in power. But the cabinet appears to work in I'm sorry to say, disjointed way. Where one says we told these ones, public service says health, we told the health. Health says public service. Public service, finance. Finance, so we are being tossed up and down. No one owns up the mistakes. And no one, says, forgive us, this was an error. So we are saying cabinet can work hand in hand. They sit in the same cabinet, the ministers, and some of the officers are too close. The officials, why don't they communicate on such issues, to prevent this? So we have notified, and let me go back. We are requesting that cabinet sits. We expected cabinet, when we met the minister, we thank government. It gives us listening ears, though after time. When we met the Public Permanent Secretary, Minister of Health, and Director General of Ministry of Health, about 2 weeks back.
Was that at the same time the senior house officers met her?
Yes, we met. Personally, I was there. And when we met, still they denied that they have not received documents which were stamped by their own ministries. I'm telling you, I'm not telling lies. Now, we were promised that special medical officer, special grade associate consultant, don't go on strike. And even they say, don't go on strike, because these issues are going to be addressed in cabinet, especially the issues of intern and SHOs. And we had gotten wind of the parliament discussing these issues. Parliament just here across. Now, when cabinet sat, that was on Monday, I think, last week.
Yes.
They did not include this issue on our order paper, and our ears were there. So, and we had primed them that if these issues are not addressed, we are also escalating this strike to involve specialists. So who is not prioritizing health? Who is laying down tools? Who is laying down hands? Is it we doctors, or is government which is failing to prioritize health? So government here is not acting genuine. Now, they tell us when Honorable Bariomus came out, Minister of Information and the National Guidance, I think is Honorable Bariomus,
yes.
ICT and National Guidance. He says, no, this issue is going to be addressed in the next subsequent meeting. So who fails to prioritize? Isn't it the health of Ugandans which should actually take precedence over all other issues? So, and we're saying, today cabinet is sitting again. We have requested, they have told us they are going to discuss these issues, not only for the specialists, but even the issues affecting the cadres below us, the senior house officers, who are working hard to become, specialists, associate consultants. And these are the ones in pipeline. And we're saying, if you distort this pipeline of intern, medical officer, senior house officer or master student, and medical officer special grade or associate consultant, you are entirely distorting the entire health sector in Uganda. You are actually, not only, it's like you are causing a coup on the health fraternity. The health sector in Uganda can collapse if these issues are not addressed. And it has collapsed before. In the 70s, long before we were born, professors ran out of Mulago and Makere. And we have made strides from there. Let us not go back from where we have not. If we act genuine, if we sit on tables, let us sit as adults. Let us sit as equals. We should not be taken as inferiors, because we are highly skilled and highly educated people.
So what would you like to hear coming from the cabinet meeting today?
The cabinet meeting, we are happy they are sitting today. We pray that nothing stops this cabinet meeting, because we are requesting, one, we have the issue of medical officer special grade. We are saying we need, in total, to address all these issues of interns. Okay, they are sitting home for more than 9 months. People have sold their goats, they have sold chicken, they have sold land and cars. People have gotten loans. Even us, government, we have given these students loans for State House, and we are saying they are home for 1 year. So we want the interns to be deployed immediately. In total, we need 100 billion. But 3 days back, I'm telling you, Minister of Finance under Honorable Musasizi presented what can I call it? An addition to the budget, supplementary of 4 trillion, of which our issue was not included. And it's around social media that this minister has said is not going to include this issue, even though Parliament passes it. And we are saying, who are the bosses of this country? It's we citizens who have authority. So if a minister can refuse to follow what Parliament has passed, isn't this a vote of no confidence in this honorable minister? And we are saying, please, we need to pay the intern doctors. We are not going to deploy hungry doctors. Let me go back to the proceedings of the meetings which we had with the Office of the Prime Minister. The outcome. First, on that day, on Thursday, there was a meeting between the ministers, the key line ministries, Public Service, Health, and Prime Minister, with Vice Chancellors and Deans. And we got communicated. This one, I was there. The Prime Minister tells us that they have accepted, they have decided that internship, they're only going to pay interns who have been sponsored by government, on government. And this constitutes a third of the whole internship, crew, which means over 1,000 students will be left to their parents. They will be given posho and beans, and we said no. a frank no before the Honorable Nabanja. We cannot accept this, and we are not going to supervise hungry doctors. Unleashing or rolling out hungry doctors is going to be causing further extortion on already a weak population. This will not be effective. This will be defective. And this one, we rejected it completely. And as here I'm online, I'm here speaking, we have rejected the issue of deploying hungry interns, unpaid interns. It will be the first of its kind in the world that a country cannot prioritize doctors, cannot prioritize nurses and midwives, whom yet is saying these are the backbone of the economy of this country and the livelihood of this country. So the issue of interns, we are saying government owner, look for supplementary. You can look for supplementaries in many things. You cannot ignore the issue of health. Health is a commodity. Health is a pillar of development. Health cannot be ignored and left to the dogs. Now, we go about the issue of senior house officers. These are master's students. And we need them because these are informers through their research. A lot of research is lying idle in Mulago here. Senior house officers, they need roughly about 30 billion, to be able to carry on. Can we have a policy to regulate and supervise interns, but at the same time regulate senior house officers? Okay, we are having a lot of liberalization policies within government for. So the numbers of interns have increased because medical schools have increased. Senior house officers have increased. But the needs of Ugandans are increasing because Uganda is a fertile country. Uganda is fertile, not just the soils. The people are producing. Each woman, in her reproductive age can give birth to at least 5 children. So the fertility rate is high. So the needs of the population grow, and hence their services should grow. So let us harness, let us take advantage of the increasing doctors, but also be cognizant and also cater for the quality. So it's still the role of government. We don't have two governments here in Uganda. It's government which gives permission to these universities to train. It's government which, controls the boundaries of this country. We are having so many students coming in to do medicine from here, and they are a resource for our economy. Government should stop playing around and saying we are training many doctors, we are doing this. It is the one in charge. We don't have two governments. And they should own up, should come up with policies. We are here, we can be consulted at Uganda Medical Association to guide on if it's exams, we go that way. But there should not be exams to prevent people from progressing. There should be exams which are intended for a goodwill. So
very quickly, because unfortunately we've run out of time, what's your final say on this issue? What would be enough for medical officers special grade to get back to work and say now we can start working again and end the industrial action?
Now, we are saying for medical officers special grade to go back to work. We had agreed, actually, negotiations, that we earn at least 11 million. That was a negotiation before. Before we were given 6 million. And when we looked into the mathematics and the calculation which the Honorable Public Service Minister presented, we cannot be tied into the mathematics because the health of Ugandans cannot be tied into mathematics. Health is invaluable, priceless. You can't tie it even to $1 trillion. We are saying, can you give us at least 11 million and we go back to work? Our title, we are happy. They have agreed to change the title. We have so many people, our colleagues who are not deployed. Let's deploy them. Let us promote them. Let us act fast before these people are taken away by our surrounding countries. So we are asking government to fast track on the promotion, deployment, and at the same time remuneration of our cadre. And we are saying for the budget, or for this budget of 2023-2024, the new budget which is supposed to be read, we need only 21 billion. Is that too much? Government, are we asking for too much? We are seeing people bringing supplementaries of trillions. 80 billion is being put in an area to help one investor not collapse. Lubowa took 1.3 trillion, which was a loan that we got for an investor for a hospital which has not come up. We're asking for 21 billion. Is it too much? We're asking for 100 billion in total to have our interns running and our senior house officers. Is that too much from government? Is this a government that is prioritizing the health of workers? Are we saboteurs? And isn't this the real patriotism we're talking about? So who is not being genuine here? And Ugandans, we leave it to Ugandans really to judge us. Are we the ones who are not genuine? Or is government which is trying to act not genuine? But we thank government that listens to us. We are not mad people. Okay? Many of our cadres can work here and abroad. But we are saying we are acting patriotic. We need to work here. We need to be facilitated. We need to be motivated. We need to be, encouraged. We need to be promoted. We need to be seen progressing. We cannot continue this way. And we are saying no amount of threat will make us back on our demands. It should be reasonable agreements. It should be reasonable discussions. It should be respectful discussions that we come to the bottom of the problem and the solution to this problem. As adults, as human beings, as people who have a stake in the affairs of this country, then we shall go back to work. But we shall not go back to work through intimidation and threats.
And indeed, we hope that soon this issue shall be solved so that those who need your medical services can get them. Thank you so much, Dr. Joe, for joining us on Issues at Hand this Monday. And thank you, our viewers and family members, for also being part of the conversation. You've heard what the medical officers, special grade, have to say. Please, what is your say on this issue? Send us a comment either on Church of Uganda Family TV, that's either on Facebook, Instagram, Twitter, YouTube. We want to hear from you. So Church of Uganda Family TV on all of our social media platforms. Please, we want to hear on what you think and what you would like either government to do or the medical officers, special grade, to do as well. But we wait to hear the results from the cabinet meeting this day. Thank you for joining us once again. We shall see you tomorrow. For now, God richly bless you and enjoy the rest of the programming here on Church of Uganda Family TV.